Hi, Professor Wade. I'm Nicole Hilderman, just doing my 10-minute talk for you that I would give to the class if I could be there tomorrow. So I was part of the group with a PICO question. Does the administration of the influenza vaccine to children result in lower flu rates or flu-like symptoms compared to children that are not vaccinated against the influenza? So a lot of the studies that we looked at started with identifying what flu symptoms are because that was what they were measuring. So commonly people will say things like, I got the flu or I caught the stomach flu, but it's actually not the flu. It can often be a stomach bug or a cold, like the common cold. The flu itself is important to specify because it's a potentially dangerous virus that can end in pneumonia, hospitalization, or death. So the flu and the common cold have similar symptoms because they're both respiratory illnesses. So some people in our studies presented to the emergency department with flu-like symptoms, and then they would swab to actually test for the influenza virus itself to get the distinguishing between the two. The flu symptoms that most of the studies used were a fever, a cough, sore throat, runny or stuffy nose, body aches, headache, fatigue, and some people may have vomiting and diarrhea, but they didn't specify that in a lot of them. So the flu can last just a couple days or a couple weeks. And the onset of symptoms is usually quick and can range from mild to severe at onset. So we mapped out one of the slides on our poster is a map of the United States where we looked at where the studies were done. Mainly it was centered on the East Coast of the United States, but there were a couple others throughout like Colorado, Seattle, Washington. And then there were one international studies. One was in Taiwan and one was in Japan. And we looked at those as well. So what the studies were measuring was vaccine effectiveness. So if the people did get vaccinated, how effective was that vaccine? So one of the first that we did was the Schuler study in 2003 and 2004. The sample size was 7,139 children aged 6 to 59 months. And when they compared fully vaccinated children to the unvaccinated children, they did find that it was effective. For 6 to 23 months of age, it was 52%. And then for 24 to 59 months of age, it was 45 vaccine reduction. There was the Eisenberg study in 2008. It was studying the 2003, 2004, and 2004-2005 influenza seasons. That was a sample of 972 children aged 6 to 59 months, and for the 2003-2004 year, and then 1,502 children for the 2004 to 2005 year. So the study claimed for that first year that there were too few fully vaccinated children to assess the vaccine effectiveness. So they did use the data from 2004 to 2005 and found that it was 60% effective. The next study that we used was the Ferdinand study for 2011-2004 flu season. This one was a pretty small sample size of 309 children aged 6 months to 17 years. So it covered the whole pediatric range. And they found that fully vaccinated children were 74% less likely to be admitted to the hospital with the influenza virus. Then there was the Sioux study, which was for flu seasons 2004-2005, and then 2008-2009. So all those years they did this study. And the sample size was 4,494 children ages 6 to 59 months. And they found that the vaccine effectiveness was 62% overall. And then the last study we used was the WACI study, which is for the 2013-2014 flu season. And this one was 1,089 children ages 6 to 12 years, so it kind of did the older pediatric range. And the children were split into two different groups. And this is a study that we will talk about a little bit later, but basically it was finding that a probiotic drink was more effective than the flu vaccine itself. So the recommendations that our group had to create a study to continue on this was a 5-year experiment that used a homogeneous sample where people had similar demographics and environmental factors, and especially a health status that's similar. And then it would be a randomized control trial of children 6 to 59 months. And the groups that they would have would be the vaccinated versus unvaccinated. And what they wanted to do differently than what a lot of the studies that we looked at did is to, instead of going off of a parent's report of what it was, to actually have a professional documentation that they had the flu. Some of the studies we looked at did have actual swabs with that were verified by the that it was the influenza virus, but some of them just took parent reports of symptoms. So the implications of the flu is that children are more susceptible than adults to the flu, which is why we were studying the pediatric range. And then because the kids are in school, there's an increased chance of spreading to other families, and then the families spread it to the work, and then increased work absences can lower the productivity and increase health expenditure, which lowers the economy. So yeah, research suggests vaccination or other preventative measures can save lives and prevent all these other implications from happening. So the gaps and limitations in the studies basically is, as I spoke about, was the having parental reports about immunization as opposed to actual documentation. Also, some of the samples didn't have enough fully vaccinated children because a lot of the pediatric vaccines are 2-part. And so parents will get the first part, but not the second part of the vaccine. And so one of the other factors that was big is kind of why parents choose not to vaccinate. So one of the reasons is the lack of access to the preventative care due to health disparities. Also, people in lower socioeconomic status have harder access to vaccinations. Some parents believe that vaccination doesn't always mean immunization. Also, there's a lack of understanding about the education for the risk versus benefit of why you would risk things like allergic reactions to a immunization when you're not necessarily sure that your child will get the illness. Also, children can naturally build their own immunity, and there are also cultural and religious issues behind not vaccinating. So the literature supported our PICO question because the data that was analyzed basically showed that children who received the full dose of the flu vaccine had a lesser chance of being infected with the flu virus. The literature did contain strong evidence to debate that if the flu vaccine was administered, then it helped decrease the flu rate by more than half. And they did have large sample sizes in the studies that we researched. So the other, the article that we found that didn't disprove the flu vaccine, but did give a different opinion, was that ingestion of a probiotic drink is as effective as the vaccine itself, especially if people hadn't been vaccinated. So what they found in that study was the group that did not take the probiotic drink had a 23.9% flu incidence, and the group that took the probiotic had a 15.1% flu incidence. And so this was a p-value of less than 0.001. So that does show that potentially there are other options of ways to prevent the flu, and the flu vaccine isn't the only way to do it. So that is my talk, and I would take questions. And that is the end of the flu vaccine discussion.